بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. I was giving a class to third year medical students last week, and that was about road traffic accidents and traumatic brain injuries. During the class, most of the students were quiet, but sometimes you find students that pop in and out with questions, and this was the case with Mr. Assaf al-Assaf. So my advice to you is never think that this is an interrupting students to your flow of the lecture, but consider that he is the most awake student and active, and thanks for him, he raised important topics that I'm discussing now. So on the way out, he shot a question saying, if a dural venous sinus, and especially the straight sinus, was torn, where will the hematoma be? So I thought that instead of giving an answer on the go, I will discuss it in details and plot it on my website and the YouTube channel. So let's start by knowing the meninges. From your study, you should know by now that you have a dura and you do have the arachnoid and of course the pia mater that is most intimate to the brain surface, and that the dura is not only a single layer but it is a double layer sheet that has the endosteal thick layer attached to the skull and the meningeal layer of the dura that separates from the endosteal in certain areas. These areas, when they separate from each other, they will engulf what is called a sinus filled with venous blood. Now, these meningeal layers, they will join at certain areas to make folds within the cranium. These folds include the fox cerebri, the tentorium cerebelli, the fox cerebelli, and the diaphragma celli. Now, a few words about dural venous sinuses. We do have single dural venous sinuses, and these include the superior sagittal sinus, the inferior sagittal sinus, the straight sinus. And we do have paired dural venous sinuses that include the cavernous sinuses, the superior inferior petrosal, and the transverse sinus. Now, the junction of the superior sagittal, the straight sinus, with both lateral sinuses, this point specifically is called the confluence or the herophily or the turcular herophily. Now, note that the sinus itself is engulfed by both layers, as we said, which are the meningeal layer and the endosteal layer. Now, let's think about a trauma that is tearing one of the sinuses, like the straight sinus or the sagittal sinus. So, if this torn or tear, if this tear involved the endosteal layer only, then where will you expect the hematoma will be? Correct. It should be between the bone and the endosteal layer of the dura, and thus it will be an epidural hematoma. Now, if it involved the meningeal layer, it will be between the dura and the arachnoid membrane. So this space is called the subdural space. Now, it comes without saying that a good force fracture trauma, it will cause tear in both layers, and thus it can result in an association of an epidural as well as a subdural hematoma. Now, let's come to some examples. This is a CT scan, and this is an MRI of a patient having a subdural hematoma, that is the accumulation between the dural layer, the black line, and the arachnoid membrane, and thus it is following, and this is the characteristic of a subdural hematoma. It follows the surface of the brain convexity. Now, sometimes it's not only the convexity, but this hematoma can follow the convexity and the surface of the brain to dip into the interhemispheric space, as well as to drag down over the tentorium, like the case here. We have a hematoma that is in the interhemispheric space posteriorly, and it reached the convexity of the brain as well as over the tentorium. Another example, and it's more clear here with a coronal view of an MRI, that an interhemispheric hematoma can flow and drag down over the tentorium, causing a tentorial hematoma, and this is from a tear in the which layer? Correct, this is the meningeal layer of the dura. Another example with a convexity and associated tentorial hematoma. I hope that this answered Mr. Assaf al-Assaf and all the others that were asking about a tear in a dural venous sinus causing a subdural hematoma. Now, to know more about cranial venous system, I ask you to log into my web channel and YouTube, and thank you for listening from Al Madina Al Munawwara Taiba University.